I would like to ask you that you've been working in the public health space for years now. 75 years, India has achieved a lot when we talk about healthcare. What do you think has been India's biggest achievement according to you?
Yeah. As a public health person, I must tell you that when we became independent, and before starting, I must remember Gandhiji's contribution not only to our independence, but his wisdom about health. What he said is gold and silver are not the real wealth of the nation, but health is the real wealth of the nation. So he also recognized that. What I think, as we became independent, the British had created a health system which was to deliver health to their armed forces. So that is why there were military hospitals in big cities and there were civil hospitals, some to the British and Indian servants of the British Raj to get treatment. But there was no health system almost in rural areas of India. So the first thing, and of course it was British officer, Sir Joseph Hoare, who was commissioned to survey what is needed for rural India. And after independence, the whole primary health care system which we created with more than 25,000 health centers, which is one for 30,000 across India, more than 150 sub-centers with nurse midwives and now community health officers, one for each 5 villages. And now very recently under National Rural Health Mission, the Asha workers and community health officers. So today we have the foot soldier of the health system in each village, which is unimaginable when we were becoming independent. So I would say as a public health person, this is one of the main game changers. And all countries who changed their health system did it. China did it in the 70s through their barefoot doctors. Malaysia, Brazil and other big countries, diverse countries created a workforce, because a villager who lives in a village of 500 or 1,000 is 20 kilometers away from an MBBS doctor, is 50 or 100 kilometers from a specialist, and maybe 200 kilometers from a district hospital. So if he falls sick at night or has a difficult delivery, some woman, who is the person? So that is the first game changer, I would say, that expansion of our rural health services. Of course, we need to do more, but it is, and we saw how our Ashas, ANMs, medical officers, other laboratory technicians worked in the rural areas and prevented COVID and as well as provided the care. Second, if you want to count the successes of public health, was smallpox eradication, which happened in 1977, started through vaccination programs 200 years ago by the discovery of vaccine against smallpox by Edward Jenner in Britain, and later on through WHO and other international efforts, we eradicated smallpox. Not only vaccination was available for 200 years, but surveillance, where it is happening, how it is getting transmitted, how can we stop the transmission, bring vaccination, and we throughout the world removed smallpox, which is a major curse in public health and infectious disease. Similarly, polio eradication, immunization program, the child health improvement. At the time of independence, almost 150 to 200 children were dying in the first year of life after birth, as compared to now less than 30. Maternal mortality, delivery, it is not a disease. Delivery is not a disease. It is a normal physiological process. But the estimates of mothers dying in delivery was almost 1,000 to 2,000 mothers dying per lakh of deliveries, 100,000 deliveries. So 1% mothers were dying just in the process of delivery. We have reduced that to less than 100. So these are some of the big achievements and game changers. Of course, we can discuss more, but I don't want to take up all the time. But we can further think of what we can do and what we have also achieved.